Welcome back to Nourished Inside Out, the space where growth gets real and self love leads the way. I'm your host, Aneta, and before we dive into today's episode, I want to remind you of something powerful. You are worthy, you are enough, and you don't need to wait for permission to love yourself fully. That's exactly why I wrote my book, Blooming with Self Love, to give you the tools, affirmations, and daily mindset shifts to help you stand in your power and own your story. This book isn't just words on a page, it's a movement. So if you're ready to stop shrinking and start showing up for yourself, grab your copy today with the link in the show notes below, and let's walk this self love journey together.
I was experiencing the arrival fallacy, which is, hey, when I'm a medical student, everything will be fine. When I'm a resident, everything will be fine. When I'm an actual doctor, I'll be able to relax. Once I've been practicing for 5 years, then everything will be fine and I can relax. Well, what happened was everything was fine. I had been climbing this mountain my entire life, and I get there and I look around, and my only thought was, okay, what's next?
Hi, everyone. Welcome back to another episode of Nourished Inside Out. Today I'm here with Brett Cordis, and Brett is a recently retired ear, nose, and throat physician and surgeon who is now launching his own private physician coaching business. His career was almost completely derailed as he battled the disease of addiction. However, through consistent hard work founded in humility, he was able to rejoin the career that he always loved, and now he's coaching physicians with symptoms of burnout and substance abuse. Thank you so much for joining us today, Brett.
Thanks so much for having me. I'm glad to be here.
Absolutely. Do you mind telling us a little bit about your journey of going down the medical route? Is it something that you always dreamed of, or what inspired you to go down the medical route?
Yeah, no, there isn't a single nurse or physician in our family. Our family is mostly either teachers or some sort of an academic, and we have a lot of lawyers too, but no one in the health field. So I was in college, finishing my first year of college. I was a history major just because I enjoyed history. Had no idea whatsoever what I wanted to be. And then I actually developed cancer of the lymph nodes, lymphoma. And after I battled that for a year and a half, I had to take some time off school, obviously, but after I battled that for a year and a half, it made me change majors, and I went to medical school and became a physician.
Wow. So, would you say that you were inspired from your personal challenges?
Yes, absolutely. I was 19 years old when I was diagnosed. So,
Okay.
like any probably typical 19-year-old, I essentially felt invincible to things like that. So for the first 6 months of treatment, I just assumed everything was going to be fine, and I was inconvenienced, let's put it that way. But the cancer came back. I didn't even finish my radiation treatment. The cancer came back, and then it got my attention that second time. So was treated in Houston at a big cancer facility in Houston. I had a stem cell transplant, and then kind of seeing the medical field as a patient, just, yes, it inspired me to do that. So I felt like I had a unique position and I could improve upon some ways care was delivered to me. So absolutely inspired by it. There were lots of silver linings in that experience, but that was one of them.
Yeah, one of the things that you talk about that I really like on one of the topics is burnout from your career. Your previous background was working as a physician and a surgeon, and now you're coaching other physicians and surgeons. Can you tell us what your career was like working as a surgeon and what led you to burnout?
Sure. To appreciate how my burnout developed, I'll back up a little bit. My father was a professor of mathematics. He was a mathematician and taught advanced calculus in college. My mom was an English instructor, and she taught English in college. My sister was salutatorian of her high school and is an attorney. And she's 10 years older than me. So by the time I was 8 years old, I had basically excellence and nothing less than excellence modeled for me. Now, I was never told or pressured, hey, you have to make all A's or else. But I just felt like in order to fit in just with my family, I had to perform at the highest level at everything. That was a lot of pressure when I was growing up. But I did get a lot of praise. get an A on a test, get praise, score 20 points in a basketball game, get praise. And so I ended up depending on that praise for any sort of self-worth. And after I had been practicing, I started practicing. I finished residency in 2009, and I started private practice inside the Texas Medical Center in Houston. And things were going absolutely fantastically for the first 4 to 5 years. I had either been studying or training until I was 32 years old. I was 32 years old before I had an actual first job, which is kind of silly when you think about it. But anyway, everything was great. I was building my practice. My wife and I had two wonderful children. We lived in the suburbs south of Houston. Everything was going very well. And then somewhere around 4.5 to 5 years into practice, I started to feel like I was getting bored a little bit. Now, in retrospect, when I look back on it, really what I was experiencing was a lack of fulfillment. But at the time, it felt like I was bored. So I would start, almost creating little goals for myself to achieve. So I would have something challenging to do. But in reality, I was experiencing the arrival fallacy, which is, hey, when I'm a medical student, everything will be fine. When I'm a resident, everything will be fine. When I'm an actual doctor, I'll be able to relax. Once I've been practicing for 5 years, then everything will be fine and I can relax. Well, what happened was everything was fine. I had been climbing this mountain my entire life. And I get there and I look around and my only thought was, okay, what's next? What's the next challenge? What else can I do? What else can I start?
Yeah.
And the reason for that is that my whole self-worth was always tied up in being praised for achieving things. I didn't feel like there was anything left to achieve. So that boredom led to anxiety and depression. And ultimately, that was the cause of my substance abuse.
Yeah, I'm happy you brought that up because I think a lot of times when we're in a growth mindset or we're setting goals for ourselves, we don't have time to look at the outside factors or what people outside of us are doing because we're focused on achieving the next goal or we're focused on growing in our career. And I can relate with you in some aspects on that because I used to be a hairstylist and it was great. There was so much to learn. I learned as much as I could behind the chair, took every client that I possibly could. And I eventually got to a point where I felt like I could do it in my sleep. Like sometimes when my
Hmm.
friends ask me, they're like, "Oh, can you just do my hair?" And I'll style it and curl it in like 5 to 10 minutes. And they're like, "Wow, you're done already?" And it's like I feel like I could do it in my sleep. And I think that also led me to some form of burnout where I was ended up just partying so much to feel fulfilled in certain areas because I didn't feel like I could grow more. So when you say that you felt unfulfilled, is that what led to substance abuse? And how did that affect your career?
Yes, I would say what I was experiencing as boredom was definitely a lack of fulfillment.
Okay.
And so, again, looking back on it, that was really the first symptom of burnout, which was the boredom slash lack of fulfillment. Some other factors that went into my personal burnout include I just didn't feel kind of appreciated by either the patients or the hospital system, and certainly not the insurance company. Insurance companies are disasters. That's my own opinion. It's even the job of the patients to appreciate me or the hospital to appreciate me. That's not their job. But again, because I tied my self-worth to what people thought and what people told me of myself, that's why I felt underappreciated. And then there's other physician-specific factors. Essentially, there's not enough hours in the day to do all the doctoring, not all the non-clinical work, paperwork and charting and whatnot. So that all kind of culminated in my burnout. And so what I would typically do on a Friday afternoon would be to get home, my wife and I would go out by the pool and I'd open two Bud Light Lime beers, drink those two while the sun went down, and we would just kind of relax and reflect on the week and talk about the weekend. One Friday afternoon, a drug rep happened to bring by some cough medicine samples that had hydrocodone in it. And for the listeners who may not know, hydrocodone is an opiate. That's what's in painkillers. Back when I was 19 and 20 years old, I was treated with painkillers several times during my cancer battle. And at that time, I liked the way they made me feel. But it wasn't earth shattering. It wasn't this huge euphoria that you sometimes feel about. And it never even occurred to me back then to continue to take that medication after the pain went away. It didn't feel that good. So I was thinking that this little cough medicine sample would be similar to the two beers, but I was very wrong, because this time I did experience a life-changing euphoria. It was the most relaxed and the best I'd ever felt in my entire life. That goes to show you that there's much more to addiction than just the substance or the activity involved. You know, there's got to be a void in your life somewhere that substance is filling. And so in my case, it was this lack of fulfillment. And that decision to take that one little cough medicine sample ended up in a 5-year progressively worsening addiction to painkillers.
Wow. So how long did it, well, I have two questions. How long did it take you to notice that you weren't feeling fulfillment from your career anymore? And how did, on a day-to-day basis with that drug, how did that look like? Were you taking it at work or after work? What was that like?
Yeah. The way that training to be a physician works is you're 4 years in medical school and then 5 years in my case, ear, nose, and throat surgical training. So in years 4 and 5, you're really functioning as a physician for the most part. You still have eyes and ears on you to make sure things are done properly. When I started private practice in 2009, I had already been functioning as a physician at least 2 to 3 years. It was right at the 5-year mark where I started to experience this lack of fulfillment. I've just recently been told that that's kind of a thing, apparently, that about 5 to 7 years into practice, physicians are starting to question whether they made the right career choice and whatnot. So I'm not sure exactly what that's all about, but for me, it was 5 years. It began by taking, the painkillers after work. So instead of a couple of beers or a glass of wine at night, I would take these painkiller pills. And then it became before work and after work. Eventually, it did become before work, at lunch, and after work. It took 3.5 years to get from taking it only after work to taking it throughout the day.
Wow.
3.5 years. It was a very, very, very slow process. My partners constantly told me that I was working too hard. Take some time off, Brett. Take a week off here, a week off there. You can even take an entire day off every week. Because that's what they were doing. When I started, I just loved it so much. I had so much fun and I was getting so much fulfillment out of it that I just worked nonstop for almost 10 years. But by year 4 and 5 of my drug use, I was definitely using it throughout the day. And I would have to ration my supply over the weekend because I could only get it at work. Toward the end, it wasn't about feeling that euphoric high. That was long, 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 long gone. By this time, I was just taking the medication to not experience the withdrawal symptoms. I had convinced myself that I was a better husband, I was a better father, I was definitely a better surgeon taking these painkillers all the time. That's how warped my brain had become with the disease of addiction.
Wow. Would you say because you were taking them earlier when you were around 19 years old and then took them years later, do you feel like that had an influence on it because you had taken them before and then had a break for a period of time and then you went back? Do you think that influenced?
Oh, it 100% influence because when she brought that bottle of cough medicine, my very first thought was thinking back to how those made me feel when I was a patient. I remember them feeling good, but nothing like it ended up feeling that Friday afternoon. So again, I'm not saying that I blame cancer for the addiction, but the exposure of the medication was definitely a factor.
It's like if you are constantly drinking and then you get sober and then you take a break from it and then you go back to it, the cycle can restart again. So it's totally makes sense. And you were taking it at 19 years old for a valid reason, for an actual painkiller prescribed from a doctor. So that's valid because I know of someone who was addicted to opioids, and when he was getting his wisdom teeth out, they had to put him under, but he didn't want to take any painkillers because he didn't want to get in that cycle again. So it's totally valid of how the cycle can happen. Now you coach people who are surgeons and physicians in burnout. How has that transition been for you?
Yeah, that's the big question. Although it might sound similar, I mean these careers are as different as engineer and artist. So in 2019 is when the house of cards came crashing down, so to speak. I was turned into the board, and I was fired from my job in 2019 for taking and being addicted to the painkillers. I went to a 3-month rehab facility in 2020, which was both mandated by the state licensing board and also by my wife. And I needed it. There is no question whatsoever. I had tried to slow down. I had tried to stop several times. If I wanted any hope at all of beating this, that I was going to need some help. So I willingly went to the rehabilitation facility in 2020, and it was a very, very positive experience. I learned, a lot of the motives behind my actions and my inactions. I learned, some character defects or character flaws that I had that I finally was able to acknowledge and then improve upon. So my recovery began in 2020. I was out of work for almost 4 years because of all the mess that I had created with the medical board. And if I thought I had a lack of fulfillment when I was working, when I had been out of work for 3 years, I was in really bad shape mentally. I was having really horrible depression that eventually led to panic attacks and anxiety. It was not a good 4 years. A specific person in my life who I'm extremely grateful to gave me an opportunity to start working again. So I went back to work. I originally started working in Texas. We moved to Louisiana. So I went back to work in Louisiana, and I signed a year contract. And after about a month, I liked it, but I didn't love it anymore. The passion that I had for clinical medicine was gone. I still loved my patients. I still loved treating and getting to know my patients. But the work itself, and certainly all of the non-clinical paperwork, chart work stuff, it was just too much for me because I didn't enjoy the actual work as much. So I worked for a year, and then purely through fate, I ended up reconnecting with a resident that I trained with. And she was a coach, and she coached surgeons, not just burnout, but for wellness and for leadership skills and whatnot. And after talking for a couple of days, she mentioned that maybe I would be a good coach because of the experience that I had myself with burnout and substance abuse. So long story short, I'm still training. It's a 10-month training program. So I'm finishing up my training for coaching. I've already started coaching physicians and surgeons, and it just combines my areas of expertise. I'm coaching physicians. I'm talking about burnout and sometimes substance abuse, both of which I experience. And it's not really a teacher role per se, but I always enjoy the teacher part of being a doctor and being a resident. So it combined all of my skills and interests. And so that's what I'm doing now.
And that re-sparked your light to want to stay in the medical industry and to take and to
Absolutely. Yeah, that's a great point. It did. It has been a wonderful experience to feel that passion again, on the professional side of things. Because everyone's, or most people have heard of the saying that you won't work a day in your life if you love what you're doing.
Yeah.
And for me, that's absolutely true. It's fun. The fulfillment is back. I'm in a much better place, and I feel like I'm paying it back. I don't feel like I'm providing a service more as much as I am. I'm paying what I've received back.
I think that's so beautiful. We get ourselves into a career that we enjoy for a period of time, and I think that's great. But there's always something different, especially like, I don't know from the surgeon side, I can only imagine, but your long hours, you're on your feet a lot, kind of similar to hairstylists. We're on our feet all day, it's long hours. You're in a people type of business that it does eventually take a toll on your body mentally, emotionally, and physically because you're working with your hands. You're always interacting with people. And the fact that you were able to find a new passion within the industry for yourself and make a new path is so incredible because it's taking less of a toll on you. Is that true?
Oh, absolutely. Absolutely. By the time I finished working, I would say that the ratio of me spending time with patients versus spending time with non-clinical duties like charting and, staying on the phone with insurance companies, that ratio was probably 7 to 1. 7 parts dealing with insurance companies and 1 part actually treating patients. And now it's closer to 2 to 1. So I do much more treating and directly engaging with other physicians and doctors than I do paperwork, so to speak. So I don't want to say it's easier, but it's just so much more fulfilling that the work doesn't feel like work.
Yeah, talking on the fulfilling topic, something you were saying earlier is that you were always looking for praise by achieving the next goal and achieving something good by getting that praise. And when you got that praise, you felt fulfilled. For somebody who is in that kind of mindset, what advice would you give to them so they're not looking for outside fulfillment and they're looking for fulfillment within themselves and within their career, not from outside people?
Yeah, that is a phenomenal question. So that was something I learned inside the rehabilitation facility. Is we had group psychotherapy, and I learned that one of my character defects was the dependence on external validation to build my self worth. And so what I learned in there, I learned several things, but one thing I learned is that my self worth is inherent to being a human. And if you're someone who believes in God or a higher power, my self-worth is given to me by my higher power. I don't need to perform. I don't need to achieve. I don't even need to behave well for me to be worth something. And so when I really grasped that, um, I started to turn the corner. And then the flip side of that is learning how to live in the present. And I had heard that saying before, but really didn't know what that meant, learning to live in the present. But for me, if I'm constantly thinking about what's going to happen in the future, or if I'm constantly worrying about what already happened in the past, then I'm missing the only time where I can actually make a difference, which is the present time. I'm trying to enjoy the process this time. I didn't realize that I liked climbing the mountain the first go at it until I was already at the top of the mountain. So this time I remember that. And so I'm enjoying this beginning phase where things aren't very busy. And I'm enjoying the beginning phase where I wish I was busier. There's some negative days and positive days, but instead of worrying about the future, I'm able to enjoy the present. If I don't have a lot of work one day, I can go play golf, that sort of thing. My self-worth is now both inherent and I'm able to enjoy myself in my own skin more because I've learned to live in the present.
That's such a huge message. I'm really happy that you shared that because I remember when we first talked and when we first met, you were telling me that when you were building up like your career the first time, you didn't enjoy the journey. And now that you're building up your practice again, you're really learning to enjoy the journey. And so many times we get fixed up on the end goal. But what we don't realize is the end goal will happen as long as we don't give up. But we need to enjoy the in between because the in between is really shaping us to who we are and where we're supposed to be. So I'm really happy you brought that up.
For me, one of the things that living in the present does is that it makes speed bumps or little failures, it makes it so much easier to deal with those because, when you think of them as just learning opportunities, or you think of a failure as a success in finding a way not to do something, it negates the negative aspect of, these little failures that used to have on my mental health. I don't get depressed or anxious when I don't do something right. I just chalk it up to, well, I've learned a specific way not to do something. Negative experiences and little failures have come to take on a much lighter meaning than they used to.
How can someone learn to not be so hard on themselves and really enjoy the journey?
Yeah, that's tough. I will say one thing I learned in rehab, and I would say that my recovery is kind of a hybrid between 12-step program like AA and higher power, and also some of the psychotherapy principles that I learned in rehab. I have kind of a hybrid recovery. But one of the things that I learned via the AA program is that our level of serenity or our level of peace is directly proportional to our level of expectations, or inversely proportional. So the higher I have expectations for myself or other people, the lower my serenity and peace are. So to answer your question, I've learned how to not just lower my expectations for other people and myself, but to eliminate expectations altogether. So instead of going to a meeting and thinking if this person is late, I'm going to be upset because I can't do anything about it, right? I can't control whether this person is going to be on time to the meeting. So instead of having that thought, I eliminate that thought entirely. So there's nothing to be disappointed about. There's no expectations that are there for someone to fall short with. But I would like to say that it's probably more important to do this with expectations for yourself than it is for other people.
That's such great advice. It's just really taking time to really enjoy the journey and enjoy the process and really being present. When you were working as a surgeon, did you get a chance to enjoy the present while working that career, or were you just kind of going through the motions?
I would definitely say I did not get a chance to enjoy the process, but that was my fault. There are certainly opportunities to do that. And again, my partners were always kind of lamenting, even though they enjoyed the fact that I was working so much and I was helping pay the bills. They were older and more experienced than me, so they knew that burnout was a possibility. 100% my fault that I didn't do that. But no, I did not stop and smell the roses. I did not enjoy the journey. I was not living in the present. It was always about, how did I, from a business standpoint, how did I do last month? Okay, I want to exceed that next month. How many patients did I see last month? I want to see more patients this month. And so, but I will say that from a patient care standpoint, everything was directed toward providing excellent patient care. So delivering patient care was the ultimate in fulfillment for me. So that was really never in question. As that lack of fulfillment started to build, not only was I not enjoying the process, I was starting to not look forward to going to work. And that was a complete 180-degree change for me.
When you are no longer fulfilled in your job, you don't want to go there anymore. And I get that because that would happen to me with salons because I was always that person that, yeah, I'll work extra, I'll stay late, I'll come early, I'll work an extra weekend. But when I felt like I couldn't grow at there anymore, or I didn't feel fulfilled, and I started to feel like I was going through the motions, oh, I'm coming in an hour late. Oh, can I go an hour early? I don't want to come in today. So, and I think that really becomes like a cycle. And I don't encourage people to just quit their job if there's no reason to, but if you're no longer feeling fulfilled or you can't grow there, then you need to go somewhere where you can grow, or else you're going to kind of spiral backwards. From my personal experience, like I started partying more, I started hanging out with my friends more, even though I knew I shouldn't. I started, same thing, showing up late, not wanting to come in. And I think that can be a dangerous cycle if you're just going through the motions as well.
Yep.
Yeah.
Yep.
What piece of advice would you give to somebody who is struggling with burnout or they feel like they can't grow anymore? What piece of advice would you give to someone?
What it means to coach someone through burnout. So my coaching kind of theory is based on the principle that our thoughts control our emotions and our feelings, and then our emotions control our actions or our inaction. If I have a thought that leads to a negative emotion, let's take anxiety, then my job as a coach is to kind of subtly change the perspective, change that thought such that it no longer leads to the negative emotion like anxiety or depression, and it leads to either no emotion or preferably a positive emotion. And so an example of that is, especially for surgeons like to be in the operating room and like to be doing surgery. It's fun for us. And then seeing patients in the office is necessary in order to identify patients that need surgery. So for the most part, doctors enjoy surgery more than they like seeing patients in clinic. It's very common for people to lament having to see clinic patients on a Friday afternoon. I'll have people tell me, I have to go see my patients. I don't have time. I can't. If I'm talking to them about exercising or making their own physical health a priority, they'll tell me they can't do that because they have clinic patients to see. The problem with that is that they feel like they have to see clinic patients. And I just changed that one word to get. So if you're going into a clinic full of 20 patients thinking I have to be here, as opposed to I get to be here, that way I get to deliver care to these patients. I'm grateful for the opportunity to have learned all of this stuff so I can make these patients' lives better. That's a totally different mindset. And instead of going into a clinic with a negative mindset, and which leads to frustration and irritability and being impatient, you're going in with a feeling of gratitude, and that's a whole different ballgame. So you take that sort of thought massaging, so to speak, and then you identify every thought that leads to a negative emotion in someone's life, and you make a small tweak like that, and that's how the whole coaching process works. So for me, if I was going to give someone a piece of advice, it would be to use that one phrase. Instead of having to do something, I have to go to church, I have to go to work, I have to go to the gym, I have to eat my broccoli. You can change it to I get to do those things. I'm grateful to have the opportunity to do those things, because some people can't do those things. And so that would be my first piece of advice. My second piece of advice would be, when in doubt, do the next right thing.
That's great
Simple.
advice. It's definitely a mindset shift, and I agree with that. A lot of times, exactly like what you said, I'm just going to rephrase it. We get into this mentality of I have to, but the reality is I get to. One of your bad days is somebody's best day.
Hmm.
So don't take that for granted and always be grateful for everything. Even if it starts with being grateful for the little things, like I'm thankful that I have food on my plate. I'm thankful that I get to eat this. It's funny, I kind of chuckled when you said I get to eat broccoli, just thinking of a kid trying to rewire their mind. Like, you get to eat it, like be happy about it. But that would take work with a
Yeah.
kid.
Yes,
So,
it would.
but I love that mindset shift. Thank you for sharing that. So,
Sure.
before we go ahead and wrap things up, is there any last piece of advice that you'd love to share with the audience?
Well, for anyone looking for coaching, you can find me on my website is theburnoutdoc.com. And I'm on LinkedIn and Facebook and Instagram. So just look for the Burnout Doc. And no, like I said before, It's this sort of perspective shift and thinking changes. It's simple, but it's not easy. So you're going to have, or most people are going to have lots of opportunities to do this. And a lot of times you're not going to know what to do. So when you don't know what to do, just do the next right thing in line and keep doing that until the course kind of opens up on its own.
And what does it mean for you to be nourished inside out?
Hmm. Wow, what a question. I like it. Let's see. I would say to be nourished inside out would mean that I'm staying true to myself and I'm living an authentic life. So that I'm doing things that I truly believe in.
That's beautiful. Thank you for everything, Brett. I will have all of the links where people can stay in touch with you linked in the show notes below. I appreciate you joining us today.
All right. Thank you so much for having me.
That's a wrap on today's episode. Thank you so much for tuning in and doing this work with me. If today's conversation lit a fire in you, then you do not want to miss the Nourished Inside Out Live Virtual Summit happening on May 24th and May 25th. This isn't just another event, it's 2 days of real talk, soul deep healing, and powerful tools to help you nourish your mind, body, and spirit from the inside out. We're bringing together incredible speakers, heartfelt sessions, and a community that's walking the same path you are. Spots are limited, so head to the show notes below and grab your spot now. Let's grow, rise, and get nourished together. Until next time, keep choosing you.